Today in New York City, the air is thick with ozone pollution, and it's raising alarms across the region. I'm Dean Bark. Welcome to the City Report here in New York. Let's start with this. Ozone alert. Elevated pollution levels are triggering health warnings in New York City and parts of New Jersey. With heat building, ground-level ozone, the stuff formed when vehicle and industrial emissions cook in strong sunlight, is spiking. Advisories are in effect through 11 p.m. Monday across our area and from 11 a.m. to 11 p.m. Tuesday in select New Jersey counties. Sensitive groups, older adults, children, and anyone with asthma or other respiratory conditions are urged to limit outdoor time, especially in the afternoon. Temperatures in Central Park are pushing near 90 degrees Monday and could reach the mid-90s Tuesday and Wednesday. Hydrate, reschedule strenuous activity to early morning or evening, and consider indoor, air-conditioned spaces. No, it's not just your allergies working overtime. This is the urban heat pollution combo at work. The takeaway: we have a recurring pattern that links hot spells to bad air. It is high time we prioritize sustainable urban planning, cleaner transportation, and street-level cooling that cut emissions and heat together. Next up, Brooklyn court drama. A woman gave birth inside a Brooklyn arraignment courtroom after being arrested on low-level drug charges, and advocates say it lays bare systemic failures. Her name is Samantha Randazzo, the mother at the center of this case. Public defenders, who are court-appointed attorneys representing people who cannot afford counsel, are blasting city and state agencies for a lack of urgency and the absence of on-site medical staff. EMS, Emergency Medical Services, no longer routinely staffs city courthouses because of staffing shortages, a gap that became painfully obvious. We are told Randazzo was restrained for parts of the ordeal. She had earlier been discharged from Coney Island Hospital, a public hospital in South Brooklyn, while still in NYPD custody and near childbirth. The NYPD, the New York City Police Department, has also faced scrutiny for how often it issues desk appearance tickets on low-level arrests, a move that can avoid lengthy custody before arraignment. 3 people have died this year while in custody awaiting arraignment, underscoring the stakes. State legislators in Albany are now pushing a bill to prohibit restraining pregnant people in custody. In a system designed to process cases, it struggled to process basic humanity. The opinion here is straightforward. This should be a catalyst for practical reforms that guarantee immediate medical access in court facilities and common-sense custody policies for pregnant New Yorkers. Next up, and speaking of custody and medical access, tragedy at Rikers. A 41-year-old woman, Rajpati Ramkelawan, has died at the Rose M. Singer Center on Rikers Island, the women's jail on the city's main jail complex. Mayor Zohran Mamdani, the mayor of New York City, and Correction Commissioner Stanley Richards, head of the Department of Correction, have called for transparency and a full investigation into what happened. Federal monitors, who are outside overseers appointed by a court to track jail conditions, have repeatedly cited failures in supervision and emergency response at Rikers. Last year, at least 15 people died in or shortly after leaving city jail custody. That context matters. If under investigation sounds familiar, that's because it is. The systemic problems here, medical access, staffing, and supervision, are not new. The opinion: the city needs immediate, measurable safety fixes on medical response and oversight at Rikers, not just condolences after the fact. Next up, Cross Bronx Expressway Bridge project halted. The New York State Department of Transportation, NYSDOT, has suspended the 5 Bridges rehab project along the Cross Bronx after sustained pushback from residents and local officials in the Bronx. The concern: more construction detours would fuel congestion and pollution in neighborhoods already bearing some of the city's highest asthma rates. Last year, NYSDOT dropped an elevated diversion road from the plan. Since then, the agency says it could not reach a consensus on a safer, healthier path forward. Advocacy groups including the Bronx River Alliance, a local environmental nonprofit, praised the pause. Officials say they will continue monitoring the 5 aging bridges and perform repairs as needed for safety. Worth noting, debris recently fell onto a roadway linking the George Washington Bridge to the Cross Bronx, narrowly missing drivers. Safety is not hypothetical. Looks like someone forgot the memo that temporary detours can carry permanent health costs. My read: infrastructure and public health must be planned together, not traded off block by block. Last up, shifting gears, a first for the city. A city-owned grocery store is coming to Hunts Point in the Bronx. Hunts Point is a working-class neighborhood that already hosts the city's massive food distribution center. The new store is meant to tackle local food insecurity and bring prices down. Mayor Zoran Mamdani says this is the opening move in a plan for 5 city-owned markets across the boroughs, an estimated $70 million initiative, with this first site pegged around $10 million and slated to open next year. The City Council, the city's legislative body, will vet the plan during budget hearings beginning May 29th. A second store is planned for East Harlem in 2029. Pushback is coming from bodega and supermarket owners, who argue that a government-run competitor could undercut small businesses that already operate on thin margins. Nothing like City Hall heading into the grocery aisle. Just remember, every price cut has a receipt. The opinion: addressing food insecurity is essential, but the rollout should include protections and partnerships so small, neighborhood stores are not collateral damage. And that's all the news that fits from the City Report with Dean Bark here in New York. Have a great day and join us again tomorrow.